Hello, this is Dr. Nancy Kuntz. I'm a child neurologist at Lurie Children's Hospital in Chicago, part of Northwestern Feinberg School of Medicine. And we're here today to talk about a treatment in Duchenne Muscular Dystrophy, specifically discussion of combination therapy and strategies to do that. I'd like to introduce my colleagues.
Thanks, Nancy. I'm Sam McKenzie. I'm a child neurologist and neuromuscular specialist at the University of Rochester.
Hello, I'm Caitlin Batley. I'm a pediatric neuromuscular neurologist at UT Southwestern and Children's Health in Dallas, Texas.
Wonderful. Well, we're here for a discussion of something that is really uncharted territory, I think, and that is combining some of the new therapies that have been made available in Duchenne muscular dystrophy within the recent few years. I think that it is a very exciting time. And as I sit here and consider my years in pediatrics and look at both complex autoimmune disorders and oncologic disorders that benefit greatly from cocktails of treatment that have different mechanisms of action, I'm very excited to try to see whether we get better outcomes in neuromuscular disorders with combination therapy. But it's been... Right now, I think we're at a very preliminary phase where we really have very little experience. How would you go about describing the goals of combination therapy from your point of view, Dr. Batley?
So I think that, first of all, acknowledging a bit of the unknown in these uncharted territories is always important. But I do think that our goal is to optimize, quality of life and, use these combination therapies hopefully in a way that will do so. We know that each of these therapies on their own are just, they are treatments. They are not cures. They each have their own benefits, but are limited in their utility. And so our hope is that by adding different strategies together, we'll be able to optimize muscle function, prolong strength, and, hopefully significantly delay the progression of disease and the complications that had historically been seen with Duchenne.
What would be a logical plan or protocol or approach to beginning combination therapy, do you think, Dr. McKenzie?
That's a great question. And I have this conversation with really all my patients. I try to do it at least, once a year, if not at every visit. But we still feel, at least in my practice, that corticosteroids are sort of the mainstay. Certainly have the most robust evidence base. Those can come in different flavors, whether it's prednisone or daily weekend dosing, deflazacort, or even newer agents like vamorolone. But we know that those medications have very good long-term effects in terms of therapeutic effects. So we think about that as sort of a base. And then for patients that are eligible for gene therapy, I think there's a conversation. There's certainly risks with that, some unknowns in terms of durability, but I think there's an emerging evidence base that gene therapy does have very therapeutic effect, at least for the window of time that we've examined that. So we have the conversation if patients are eligible for gene therapy and that's something that they want to pursue. Then that's something that we will usually go ahead with on top of the corticosteroids. And then exon skipping, I haven't had any patients that we've combined gene therapy with exon skipping. I think there's other considerations that go into that, such as payer considerations when we're talking about the aggregate costs of combination treatment, but also really just the unknowns in terms of how those two work together. Beyond exon skipping and gene therapy, we have new agents like givinostat. We have all of these other medications that are currently in treatment trials, things that are non-dystrophin targeting. So I think it's certainly an exciting time, but you can kind of appreciate that we're opening up all of these potential parallel combinatorial treatment regimens, and we don't have a great way as a field for coming back and comparing head-to-head data. And I think that speaks to also, the heterogeneity in Duchenne itself. So it's a very hard thing to measure. I think we're going to get there, but we certainly have some homework to do as a field to better define what's the new standard of care as these therapies come on board.
I agree. And one of the things that I think we are all aware of, treating children with Duchenne and being involved in clinical trials, is that we have a responsibility to the families and children, but also to the medical world to make sure that we're getting value and benefit from additional therapies. Is that the additional exposure to potential side effects and the additional cost is worth it, which I think means that we have to have a very good strategy for assessing the outcomes and monitoring this.